So our next presenter is Ms. Natalie Rios. Natalie is a graduate student researcher at the Center for Neighborhood Knowledge at UCLA. She is currently pursuing a master's of urban and regional planning degree. She holds a BA in sociology from the University of Chicago as well. She has experience in public health research, working on projects that address gaps in care for Blacks and Latinx individuals living or receiving care in the Bronx. Natalie will present preliminary findings from an ongoing research project at the Center for Neighborhood Knowledge. Natalie?
Hi, my name is Nataly Rios Gutierrez. I am a researcher at the Center for Neighborhood Knowledge at UCLA. Today I'll be presenting on the pandemic impacts on Hispanics, New York City COVID-19 death and vaccination. This research was done by the Center for Neighborhood Knowledge in collaboration with the Latino Policy and Politics Initiative at UCLA. My co-authors include Dr. Paul Ong, Lauren Harper, and Dr. Rodrigo Dominguez Villegas. So for a little bit of context, as I'm sure all of you are aware of, NYC was the first major epicenter of COVID-19 in the United States. And as we know from news articles and previous research, communities of color, particularly Black and Latinx communities, were disproportionately affected by the coronavirus. So this led us to ask a question, are Hispanics getting vaccinated fairly? To answer this, we compare the citywide and neighborhood level patterns of COVID-19 death and vaccination rates among non-Hispanic whites and Hispanics in New York City. We used 3 different data sources, which included data about coronavirus from the New York City Department of Health from March 11, 2021, data from the Household Pulse Survey from January to March, and as well as demographic data from the American Community Survey. Additionally, to get to our question of whether or not Hispanics were getting vaccinated fairly, we wanted to look at the differences between death rates and vaccination rates. So we normalized the death and vaccinated data. So that means we created Z-scores and then subtracted vaccination rates from the death rates to get our vaccination gap. I'll explain a little bit more about that during our results. So first, as I mentioned earlier, we looked at city level results from COVID-19. So we found that despite of high levels of COVID-19 outcomes, so that means high levels of cases, hospitalizations, and deaths, vaccination among New York City Hispanics is really low. So Hispanics are 1.4 times more likely to have a positive case of COVID-19. This number is likely under counting the disparities between non-Hispanic whites and Hispanics, since Hispanics likely don't have the same access to testing. As we can see for hospitalizations and deaths, Hispanics are almost twice as likely to die or be hospitalized from COVID-19 than non-Hispanic whites. In comparison, Hispanics are 3/5 less likely to be vaccinated from COVID-19. So in addition to looking at New York City Department of Health data, we also looked at responses from the household survey. So in these, we also find the same disparities in vaccination rates between Hispanics and non-Hispanic whites. But we also found that these disparities persist regardless of the age of the person. So we find that Hispanics who are older than 65 are still getting vaccinated at lower rates than non-Hispanic whites of that same age. And we also find that Hispanics with at least a bachelor's degree are getting vaccinated at lower rates than non-Hispanic whites. We also looked at reluctancy to vaccination among people who haven't gotten vaccinated, and we find similar levels of reluctancy between Hispanics and non-Hispanic whites. So we don't think this is what's causing the disparity in vaccination. So in addition to looking at city and regional demographics, we wanted to study the graphical patterns of vaccination and COVID-19 death. So overall, we find that neighborhoods with the highest levels of death rates indicated in dark brown on the map on the left are also the neighborhoods with the lowest vaccination rates indicated by white on the left of the screen. We further examined neighborhood level disparities by looking at neighborhoods by racial minority. So that can be seen on the photo on the left. So the dark purple indicates neighborhoods with a Hispanic majority, and dark yellow indicates neighborhoods with a non-Hispanic white majority. On the right, we illustrate our dead vaccination gap that I mentioned earlier. For this gap, the areas in dark red indicate areas with the biggest gap, which represent areas with high COVID-19 deaths, but low vaccinations. And areas in green indicate small dead vaccination gaps, which indicate areas with low COVID-19 cases, but high vaccination rates. So when we compare both of these maps, we see that areas with Hispanic racial majority are also areas with the biggest gaps in COVID-19. So this shows how the gap is unevenly distributed, especially in that Hispanics reside in neighborhoods that have been less served by vaccination, which put them at higher risk of COVID-19. We conducted a final set of analysis to understand in what type of neighborhoods Hispanics tend to live. Overall, we found that regardless of age, race, or ethnicity, Hispanics tend to live in neighborhoods with a higher risk of COVID-19. As illustrated on the graph on the right, more than 50% of the Hispanic population lives within neighborhoods with a high or highest dead vaccination gaps. This is not an indication whether or not someone will actually get sick of COVID-19, but it is about the chances of getting sick or the risk of getting sick. For example, if someone lives in a neighborhood with a high level of pedestrian accidents, it doesn't mean that they will necessarily get hit by a car, but that they are more likely to get hit by a car. We could further looked into the chances of non-Hispanic whites to live in neighborhoods with higher risk of COVID-19 across people who were 65 years or older or with high levels of education. And we find that among these groups, there's also a higher risk of death and lower vaccinations. Furthermore, we looked at differences among Hispanics based on their ethnicity. So we looked at Dominicans, Mexicans, and Puerto Ricans, and we found that across all these three groups, they all tend to have live in neighborhoods with high risk of COVID-19 death, but low vaccination rates. So just overall, we find high levels of disparities between non-Hispanic whites and Hispanics. And this is even after controlling for age or education and also ethnicity. So what does this all mean? So this shows that the public health crisis is systematically reproducing pre-pandemic inequality. It also, we hope that through these findings, we're able to highlight the importance of vaccinated individuals in predominantly Hispanic neighborhoods to lower the risk of getting COVID-19. And we hope that it also highlights the importance of continuing to investigate COVID-19 vaccination and how it's impacting other racial groups, especially non-Hispanic Black New Yorkers. We will be releasing a report with this information in mid-May. In the meantime, you can contact the Center of Need for Knowledge or the Latino Policy and Politics Initiative to get more information. We will also be making this PowerPoint available. Thank you.
Thank you, Natalie, for the interesting presentation. I think if something is indeed significant about the work you presented is that it makes clearly the point that geography matters. Your point about how the pandemic inequality we're observing is just reproducing the already existing inequities is an important one. Now, I had the privilege of being able to see some additional analysis from your group that show, for example, how the percent foreign born in the neighborhood, the percent over 65 in the neighborhood, the percent disabled, and percent with less than a bachelor's degree in these neighborhoods made a difference. So it's truly how all these indicators converge in these neighborhoods to create a very problematic situation. So could you speculate a little bit about next steps in the analysis, and hopefully, what do you think the contribution that it will make?
Yes, thank you. And thank you so much for allowing me the opportunity to present today. I think talking about the factors that you mentioned, including people with like lesser education, people, higher percentage of people that are born from outside the US, I think that this brings the questions about the type of information that's available. Like, is COVID-19 vaccination data available in all languages? I think a big, to think about too is thinking about the requirements for IDs. Are like, how accessible are the COVID-19 or are the vaccination sites? So even if there, we did some analysis looking at how closeness to a vaccination site affected vaccination rates, and we didn't see any differences. But I think that gets more to the point, what times, like having to make an appointment can be a big barrier for people who might have jobs that don't allow the flexibility to book in advance. Thinking about people with disabilities, a lot of times moving around New York City, a lot of the work that I was doing before was with people that had different types of mental or physical disabilities that require using paratransit services. Booking those services might not make it possible to get an appointment at a time and might be lowering the rate. So I think there's, first, it's really important to just add more resources into neighborhoods that have this debt and vaccination gap. And I think it's just working more with communities to see how to improve transportation and education about the vaccine, as well as like making the vaccine appointments more flexible in order to hopefully get everyone vaccinated and lower the risk of COVID-19 infections.
So what I would like to do now is go quickly over a number of sort of key takeaways from the presentations that we've heard today. And I think that something that it has become apparent is that the COVID-19 is not just a cause of significant problems in terms of mortality, in terms of potential impact on comorbidities, but it's also a compounder of inequities. In other words, that some of the ways that it's working into consequences for the Puerto Rican population has to do with existing inequities that may impact access, may impact language ability to communicate, access to resources, social networks, the impact that being unemployed or a family member in the family, a family member losing a job. For example, access to food care and things of that, food insecurity, inequities that already were in place. What COVID-19 is essentially exposing and reproducing those same inequities during the pandemic. Some key takeaways that both have some implications for Puerto Rico is that COVID-19 is amplifying the already problematic challenges for the island in terms of the long-term economic crisis, the catastrophic effects of Hurricane Maria, the earthquakes that they experienced in 2019 and 2020. In general, during that whole period, a culture of neglect at the federal level, where efforts to support the island and fund efforts that would lead to getting the residents of Puerto Rico out of the crisis just went by the side of the road. There was essentially very little interest on investing in Puerto Rico. In addition, it has further exposed the structural deficiencies of the island's health system, became very apparent during Maria, partly when it came as to availability to electrical supply or to clean water. But the impact of that has also been experienced as part of the impact of COVID-19. Second, I think that some of the compounding of some of the health consequences due to the high incidence of comorbidities in the Puerto Rican population, both on the island and on the mainland, as has been documented by the BPRHS study in Boston and now by the Prospect study in Puerto Rico. Diabetes, cardiovascular disease, hypertension, obesity, the high incidence in the Puerto Rican population, those are all factors that have been associated with more significant consequences if you do experience a COVID infection. In addition, Dr. Mate has been the point very clearly how you don't have to experience a COVID infection for COVID to have consequences on psychosocial stress, on symptomatology of depression, of indicators of stress in general, and a general sense of social isolation. So it's important to keep in mind that the impact may be indirect, but it's still considered to have an impact on the Puerto Rican population. Also, the pandemic has exacerbated challenges with access to medical care and food security. Food security both on the mainland and on the island, as we have reported in previous research, are a challenge for a significant percent of the Puerto Rican population. And then my next point has to do with sort of trying to understand the significance of some of the key points here. Essentially, that COVID-19 cases, yeah, either death rates or cases in the general population, truly do not capture, even the vaccination rates do not capture the impact on the population, the impact of the pandemic on subgroups within the population. As Natalie pointed out, the convergence of negative factors at higher levels in neighborhoods where Puerto Ricans and other minorities live have clearly has some serious consequences for rates of infection and for access to vaccination, which are significantly different from those of non-Hispanic white. Also, the point that I think it comes across all three of the presentations, that death, while it is a terrible outcome, is not the only consequence of the pandemic. This pandemic is going to impact way more people than those that we lost to the pandemic. And that vaccination is a way out of the pandemic itself, but it's not a way out of the byproducts of the pandemic. We need to keep in perspective that this pandemic will have not only physical but emotional consequences for this population, and that, as Josie Mate pointed out in her presentation, we need to consider what are the critical interventions that we need to be made and prioritized in order to begin to address some of these challenges. There's essentially no literature right now on this problem, particularly when it comes to impact on Puerto Ricans. I did a search of the current literature. I found 3 publications at this point that talk about COVID and Puerto Ricans, and they're all in the similar stage to some of the presentations that we heard today, where data are being presented from symptoms that were registered back in summer or fall of next year, before the intensification that we saw in the incidence of cases and increase in mortality that was experienced from November forward. So I hope that you keep in mind these key takeaways as we go into the section for questions. I will stop here so that we have an opportunity for those in the audience to ask questions of the panelists.
I would also like to invite our presenters, Dr. Mate, Dr. Mangano, and soon I hope to be, we hope she'll be Dr. Nataly Rios, to come on the screen so we can ask a couple of questions of the audience. The first question is a question of clarification for Natalie. And the question reads, Natalie, are you referring to COVID positive cases and survivors to the COVID centers of excellence in New York City? So can you specify a little bit about specifically the population that you're analyzing? COVID positive cases and survivors to the COVID centers of excellence. That's question number 1. Then there is also a couple of questions that are more broad. that could apply both to the case in New York City as well as the case in Puerto Rico. It says, have you looked and found differences between Puerto Rican or Latino recently arrived to the United States compared with those who have been in the United States longer? So let's take those two questions. And Natalie, if you could please address the first question, and then Josimer and Natalie, you can address the second question. And then I have another question for Kelsey later on.
Yeah, no, the data is for all of New York City, and it comes from the Department of Health. So it's not as specifically from the COVID Centers of Excellence. So it's just data from the NYC Department of Health. I hope that's clear enough. I can also give more detail if needed.
Mm-hmm. And then in terms of the recency of migration, what impact might the recency of migration to the United States be reflected among Puerto Ricans and other Latinos, perhaps in New York City, and perhaps have we seen some differences as such, Dr. Matei, in regards to Puerto Ricans on the island, in regards to migration? Natalie, if you may.
Yeah, so we unfortunately did not look at any data on how long people had been in the U.S. for. Just in general, like whether or not they were born here or not. I do suspect there is probably some challenges, like a lot of the vaccine sites are in like local community centers, so people don't have access to them or don't know about them. I can see that being a potential issue.
Dr. Matei?
Yes, I'm going to quickly mention that in Prospect, we do track migration. We have not done that analysis yet. There was obviously very little move back and forth during COVID because of the travel restrictions in theory, but anecdotally, we know, and from tracking through other surveillance systems that I have been involved in the island, especially with the Ponce Health Sciences Institute School, we know that people were indeed traveling and had a lot of Puerto Ricans moving, especially from the Florida region back to the island when things got better, and then moving back to Florida when things got a little bit harsh in Puerto Rico. This needs to be documented much better, and that's something that we will be working on because we have the data, but I cannot unfortunately answer that question fully. I'm going to deflect this to Kelsey because I know that we do have more data on migration and back and forth in the Boston Puerto Rican study.
Okay. We are getting comments or questions from the audience asking if the slides will be posted on our website. And this is a reminder to all the members of the audience that yes, the entire webinar will be available after a couple of days for your viewing, as well as the individual presentations presented here. One question for Dr. Mangano. I couldn't help but think that the data, you had 504 members in your samples, individuals in your sample. 7 had passed. 21 had become infected. This leaves proportions of about 1.4 deaths, based on a 504 sample, and then a 4% infection rate. How does that compare to other residents in the Boston area? So how do Puerto Ricans or how do Hispanics in the Boston area compare given these mortality as well as morbidity rates?
Well, thank you so much for the question. First, I'll quickly answer Josie's toss over to me that we did measure acculturation status in the Boston Puerto Rican Health Study, and we did not find acculturation status to differ between the small number of individuals who reported being COVID-19 positive and those who did not report experiencing the disease. That being said, we have a very low acculturation status in our population, so I'm not exactly sure if the comparison is fair, but we do have the data and we'll continue to follow up on that and report on that. So thank you for the question. And to answer the question regarding the rates of death and infection, I have to say I'm not exactly sure, and I don't know if, I don't mean to put you on the spot, but if Josie or Dr. Falcone have other I believe that death rate and infection rate is higher compared to other communities. To be honest, I haven't seen a lot of data published yet in other communities, so I'm not sure I can make a fair assessment.
Mhm.
What we do know is that the rates are much higher, nearly double in the communities, and then Boston is divided in cities and towns, so it's very clear-cut rather than districts or regions. And in the cities and towns that are more populated by Latinos, and most of our communities are Dominican and Puerto Ricos, there's a doubling in infection rates than in the other cities, especially in the high-income cities.
And this raises, Dr. Falcon.
Yeah, no, I was going to say absolutely that Josie is correct. The rates for Latinos in Massachusetts are much higher than for non-Hispanic whites. And in fact, it caused the governor to change their strategy for vaccination at the state level and begin reallocating vaccinations to communities with high risk. They had done the same earlier on when they were doing testing for COVID. They reallocated resources. For example, the city of Lowell, every resident in the city was asked to go out for testing, even if they had symptoms or not. The same was done in Lawrence. So they targeted a few cities that had significant minority populations and said, let's test everyone and figure out who is contagious and who is not.
Yeah.
So there have been some efforts because there are significant disparities between Latinos and non-Latinos in the state.
Yeah, it's also interesting because, of course, you know, there are two different trends that we may need to contend with, because on the one hand there is this whole immigrant paradox in which immigrants into the United States tend to have healthier or better health outcomes than say Latinos or immigrants that have been in the United States for a longer period of time, but we have also seen a prevalence of or greater incidence of both morbidity and mortality among Latinos and, you know, in this case, Puerto Ricans as well in the United States. At the same time, there is the whole issue, and one of the comments from the members of the audience is that age seems to be a much more salient variable. And we know that, for instance, in New York City, the Puerto Rican population is older than Puerto Ricans across the United States, but that is not necessarily the case in Massachusetts, where the Puerto Rican population is much younger than nationally. So I wonder to what extent age may have, you know, to what extent age is an important variable to look at. You know, we have seen that the mortality among the older cohorts is greater than among the younger cohorts, but then we have to look at the impact of workplace exposure, having to, you know, be essential workers and things of this nature. And I open it up to anybody in the panel.
Well, a couple of points. One, I think age as a factor is critical because age has to do with the life cycle, and it sort of differentiates what your activities are at a given point in time. Take Massachusetts, for example. A lot of the mortality for the population 65 and above actually took place in assisted living facilities and retirement facilities, something that the Puerto Ricans in general tend not to have access to or the resources to be able to afford those. So the fact that Kelsey has found a fairly low incidence of COVID infection in the population in some ways speak to the protectiveness of not being in a particular income bracket. On the other hand, what you're starting to see is significant rates of infections among the younger age groups in the population. And that has to do, one, that for some of the Latinos, particularly Puerto Ricans, they never left the job market. They continue working day in and day out. A number of them in the health sector, which is, I believe, is the third largest employer in Massachusetts. A lot of them that were working in health facilities without protection continue working day in and day out. In the service sector, same thing. So they had more exposure to activities that could lead to higher rates of infection. So yes, age is a critical factor because it does expose you to different activities.
Quick adding to what Luis just said is that it was very interesting because Kelsey, for example, reported a much higher number of cases that were reported in the Boston Puerto Rican, and that is an older cohort compared to our cohort in Puerto Rico, where the mean age was around 50, 51, 52 years old. So this is important, and it speaks precisely to that difference in age, even though the age structure in Puerto Rico tends to be older. And one quick reminder is that that was the situation a few months ago. And something that we have to remember is now in Puerto Rico, this is flipping. And most of the cases that we're seeing right now is actually in younger populations in the 20s and 30s, and even in adolescents. So that we have to be vigilant that yes, even though the pandemic started with mostly in the older generation and in the older population, this can shift, and this can shift at any moment.
Anybody else? Then a question for Dr. Matei, and this is in regards to trauma, the trauma that COVID itself inflicted upon the population. But of course, as we all know, COVID is just the latest in a series of catastrophes affecting Puerto Rico. The earthquake swarms in the southwest coast of the island, both Hurricane Irma and Maria, prior to that, the economic crisis. And I know that the prospect started in 2015, but I wonder to what extent this, what cumulative effects on mental health there may be as a result, and how can that be captured?
Yes, it can be captured, and that is something that we are measuring. As I mentioned, we have a very solid and comprehensive battery of several emotional and mental health, and that includes post-traumatic stress syndrome, including reasons for that stress. Is it violence? Is it adverse childhood violence and crime or events? Or is it the events that have been happening in the society? So we will be able to track that throughout times. And I have to say, Prospect, as Luis said, has been a survivor among all of these. We started right after Maria, like right after.
Seem to have a technical delay.
Track throughout of this, and we even have data during the earthquakes. So we should be able to see how these things have been shifting. And the other thing that we have been measuring are biological markers of stress. So we have markers on cortisol, for example, both from urine, from hair, which are very strong markers, and we should be able to see if this indeed has been shifting throughout these events and how it has been shifting. And more importantly, we have positive measures, measures of positive emotional health, resiliency, coping mechanisms, social networks, social connectivity, which we think are very strong buffers of this distress. So that's something that we also want to see, because we know from qualitative work that we have done that this distress is happening, but at the same time, social support and resiliency is also increasing. And I think that's the positive message that we have to keep in mind, that yes, there is distress, but there are also strategies and mechanisms that we can pull from within our community to avoid that.
Another question that stems from a query from the audience is in regards to ancillary issues that may be affecting, physical health and perhaps mental health, and this refers to food quality. What impact may food quality, whether in Puerto Rico or among Puerto Ricans in the United States, affect a person's health, and what interventions may there be to address the issue of food quality for the Puerto Rican population?
I can start and then turn it over to Dr. Matei or anybody else who wants to add. We do know that food quality has a significant impact overall, pre, post, during pandemic on our immune response. So it's very plausible that poor dietary quality would lead to a poor immune response, which could in fact affect an individual's ability to recover from disease, certainly. And that's why we also asked questions in our Boston Puerto Rican health study surrounding food security. We know we have rates and unmet needs of food insecurity in our population. Interestingly, and I think not just in our cohort, we saw a shift due to the abundance of, at least in Massachusetts, the abundance of food that was required through assistance programs in the state immediately during that first summer following the initiation of the pandemic. However, some of those resources have now run out. And so we anticipate that with our follow-up study, we may see increases now in food insecurity among certain pockets, particularly among Puerto Ricans in Massachusetts. So that's certainly something that we're monitoring for.
I'll add very, very briefly. Yes, we are tracking changes in eating and especially responses to emotional eating. So we have specifically how people are responding to these emotions through eating behaviors. What I can say is something that Luis mentioned before and that we really have to stress is that whatever pandemics, whatever disaster happen, will exacerbate what is already happening in the island. So the issue is that in the island and in our Puerto Rican community, we already had poor diet quality, poor intake, a lot of nutritional deficiency, especially in important vitamins and minerals, and high food insecurity. Almost half of the population in Puerto Rico is receiving the equivalent to SNAP, so food assistance. So the situation is really that we have to pay attention to this at all times, because when something happens, it's just gonna make it worse. So yes, we have to respond now, but then we can just not drop the ball when COVID is gone or when the hurricane is over. We have to be vigilant and we have to have these policies in place for all times. And the thing that I will highly recommend to help improve this is widening food assistance coverage and ensuring that people have access to food assistance.
Thank you. As it tends to happen in presentations such as this, now there are many more questions that there's time to answer them all. But I invite all of our presenters to continue answering and responding to some of these questions in writing through the Q&A as we move on to the next presentation. But I am going to field one more question before we conclude this segment of the webinar, and it is regarding vaccines. Two related questions. One says, it seems to me that vaccines have been more accessible here on the island than in the US. Is that the case? Question number one. And then related to it is, aside from the general distrust minority populations have in getting the vaccine, do you find that the Johnson & Johnson pause affected Puerto Ricans and other minorities in getting the vaccine? Will there be any studies to compare minority populations' usage of the different vaccines? If anybody can answer those questions. And if you don't, that's fine.
I think I responded already in the Q&A to one of these questions, which was precisely about vaccine intent and vaccine hesitancy in the island. A very good colleague of mine, Dr. Andrea Lopez-Cepero, who is also a collaborator in the Prospect study, she did a population-wide survey precisely on vaccine hesitancy and intent in the island. And vaccine intent was really high. It was over 80%. Those results are gonna come over soon. I think that might explain why we're seeing more vaccination and higher vaccinations rate in the island than here. I cannot speak too much about, whether we're receiving the vaccines or not, but definitely the hesitation, the intent is pretty high. Those results are gonna be published soon.
Anybody else?
Yeah, Carlos, I'm a sociologist, so I can always speculate. What I was going to say is that clearly conditions on the ground vary across the states. I mean, there are states where you can sign up for a vaccine and you're not going to be able to know what is being administered. So when you show up at the site, that's, they give you what they have. In Massachusetts, for example, there are large sites that you actually can choose the site based on the vaccine that they're providing. So there is some options to choose. Certainly, the J&J delay will have an impact across the board for the country. I think it will be hard to separate, and it was going to require perhaps data accessibility that we may or may not have from the CDC. I mean, the CDC is keeping records on the different types of vaccination administered. And I know in Massachusetts, for example, when you fill out the information for the vaccination, it asks you for identifiers on race and Hispanic origin. So if the state were to make that available, we would be able to identify distribution of different vaccine types across the population. But it's going to require a concerted effort from state offices to be willing to share that information.
Well, thank you, Dean Luis Falcon, our moderator and discussant, as well as our presenters, Dr. Edwin Melendez, Dr. Kelsey Mangano, Dr. Josimar Matei, and soon to be Dr. Natalie Rios, for tremendous presentations. Everybody should know that all of these presentations will be available in our website, centropr.100.cuny.edu, as well as recordings of the webinar.